Before diving into the mistakes, it's worth noting why sexual health remains relevant for men over 70. Masturbation, when done appropriately, can offer numerous benefits, including stress relief, improved mood, better sleep, and even cardiovascular health benefits. For older men, it can also help maintain sexual function and libido, which are often affected by aging, medications, or medical conditions like erectile dysfunction, ED, or prostate issues. However, misinformation, lack of awareness, or habits formed earlier in life can lead to practices that undermine these benefits. Let's explore the 4 key mistakes and how to address them. Mistake 1. Overdoing it. Excessive frequency. One of the most common mistakes men over 70 make is engaging in masturbation too frequently without considering their body's changing needs. While masturbation can be healthy, excessive frequency can strain the body, particularly in older age. Aging men often experience reduced energy levels, lower testosterone, and slower recovery times. Overdoing masturbation can lead to physical exhaustion, irritation of the genital area, or even temporary erectile difficulties, which can be mistaken for more serious conditions. The price paid. Excessive masturbation may cause fatigue, reduce sexual sensitivity or discomfort, which can lower confidence and create anxiety about sexual performance. In some cases, it may exacerbate existing conditions like prostatitis or urinary issues, as the prostate gland and pelvic muscles are repeatedly stimulated without adequate rest. How to avoid it. Moderation is key. There's no universal right frequency, as it depends on individual health, energy levels, and libido. A general guideline is to listen to your body. If you feel fatigued, sore, or notice diminished sexual response, it may be a sign to scale back. Consulting a urologist or primary care physician can provide personalized advice, especially if you have underlying conditions like heart disease or diabetes. Additionally, ensuring adequate rest, hydration, and a balanced diet can support your body's ability to recover. Mistake 2. Ignoring physical limitations as men age. Physical limitations such as arthritis, reduced flexibility, or chronic pain become more common. Some men over 70 continue masturbation habits that were comfortable in their younger years, but are now physically taxing or even painful. For example, using aggressive techniques, maintaining awkward positions, or gripping too tightly can strain joints, muscles, or sensitive tissues. The price paid. Ignoring physical limitations can lead to discomfort, injury, or aggravation of existing conditions. For instance, overly vigorous stimulation may cause penile bruising or exacerbate arthritis in the hands or wrists. These issues can reduce the enjoyment of masturbation and, in some cases, discourage men from engaging in sexual activity altogether, impacting their emotional well-being. How to avoid it. Adapt your approach to accommodate physical changes. Use lubrication to reduce friction and minimize strain on sensitive tissues. Experiment with positions that are comfortable, such as lying down or using pillows for support. If arthritis or grip strength is an issue, consider devices designed for sexual wellness, such as ergonomic aids approved by medical professionals. Gentle, mindful techniques can maintain pleasure without risking injury. 3. Physical therapy or exercises to improve flexibility and strength may also help, but it's especially important for men over 70, as the immune system weakens and the skin becomes more delicate. Some men may overlook proper hygiene practices before or after masturbation, such as washing hands, cleaning the genital area, or ensuring sex toys, if used, are sanitized. Additionally, using inappropriate lubricants or objects not designed for sexual use can introduce bacteria or cause irritation. The price paid. Poor hygiene can lead to infections such as urinary tract infections, UTIs, or balanitis, inflammation of the glans penis, which are more common and harder to treat in older age. Irritation from harsh soaps, non-body-safe lubricants, or unsanitary objects can cause discomfort and increase the risk of complications, particularly for men with diabetes or compromised immune systems. How to avoid it. Prioritize hygiene by washing your hands and genital area with mild, fragrance-free soap before and after masturbation. If using lubricants, choose water-based or silicone-based options labeled as body-safe, and avoid petroleum-based products, which can degrade skin health or harbor bacteria. If incorporating sex toys, ensure they are made of medical-grade materials and cleaned thoroughly after each use. Regular checkups with a healthcare provider can help catch and address any infections early. Mistake 4. Overlooking emotional and relational. Impacts masturbation is often a private activity, but for men over 70, it can have emotional and relational implications that are easy to overlook. Some men may rely on masturbation as a primary outlet for sexual expression, especially if they're single or in a relationship with differing sexual needs. However, excessive focus on masturbation, particularly when paired with pornography or unrealistic expectations, can lead to emotional disconnection, reduced intimacy with a partner, or feelings of guilt or shame. The price paid. Over-reliance on masturbation can strain relationships, especially if a partner feels neglected or if communication about sexual needs is lacking. Emotionally, it may contribute to isolation, lowered self-esteem, or dissatisfaction with one's sex life. For some, habitual use of pornography may create unrealistic standards, making real-world intimacy less fulfilling. How to avoid it. Open communication is essential. If in a relationship, discuss sexual needs and desires with your partner to find a balance that works for both. For single men, reflect on whether masturbation is fulfilling or if it's masking loneliness. Consider seeking social connections or professional support if needed. Limit pornography use if it's creating unrealistic expectations, and focus on mindfulness during masturbation to enhance emotional satisfaction. If feelings of guilt or shame arise, speaking with a therapist specializing in sexual health can help reframe masturbation as a healthy part of life. Broader health considerations. Beyond these specific mistakes, men over 70 should consider how masturbation fits into their overall health. Conditions like heart disease, diabetes, or prostate issues can influence sexual function, and masturbation habits may need to adapt. For example, men with prostate conditions should consult a doctor, as frequent ejaculation may benefit prostate health in some cases, but could aggravate symptoms in others. Medications, such as those for blood pressure or depression, can also affect libido or sexual response, and adjusting habits or seeking medical advice can help. Practical steps for healthy masturbation. To ensure masturbation remains a positive part of life, men over 70 can follow these guidelines. Listen to your body. Adjust frequency and techniques based on energy levels, comfort, and health conditions. Prioritize. Comfort. Use lubrication, supportive positions, and gentle techniques to accommodate physical limitations. Maintain hygiene. Keep hands, genitals, and any aids clean to prevent infections. Communicate. Discuss sexual needs with a partner or seek professional support for emotional or relational concerns. Stay informed. Consult healthcare providers for personalized advice, especially if you have chronic conditions or take medications affecting sexual health. Conclusion. Masturbation can be a healthy and fulfilling part of life for men over 70, but avoiding common mistakes is crucial to reaping its benefits without drawbacks. By moderating frequency, adapting to physical changes, prioritizing hygiene, and considering emotional and relational impacts, men can maintain their sexual health and overall well-being. Aging brings new challenges, but with awareness and care, men over 70 can continue to enjoy a satisfying and healthy sex life. If concerns arise, don't hesitate to consult a healthcare provider or therapist. They're there to help navigate this natural part of aging with confidence and clarity.